Fatima, I'd like to come back to you because some of both what Peter have said and Kamran has just talked about reminded me, and they've said it very clearly, that we've been through this before. So much of this is very reminiscent of the struggle for HIV meds. And you mentioned, this notion that we couldn't take our medication on time. What was the point? There was the fact that Nelson Mandela's administration was sued by 38 or 40 pharmaceutical companies with the support of the US government and Europeans. So I wanted to give you an opportunity to talk about that. In the moments where we feel very depressed and we think that we're not going to win this battle, what are the lessons that you can bring us from that time? Because I know that you, despite the fact that you look very youthful, were in that battle as well back then. And anything else that you'd like to add or respond to what any of the other panelists have said?
Thanks. So, I think, just to echo what Kamran and Peter and Tifa have said, in many ways, the way in which this pandemic has been managed has been worse, right, than the HIV/AIDS crisis, because we thought we wouldn't have a repeat of that. And we thought we wouldn't have a repeat of the greed and the hoarding and the refusal to share knowledge in the middle of a pandemic where you have a life-saving intervention. So, Kamran and Peter have talked about how remarkably we got these vaccines, multiples of vaccines that are considered safe and effective. They have emergency use authorization. And what happened? All of the supplies was allocated to the global north, very low targets for the global south, where Black and brown people happen to live, which is why, I'm going to go back to the point about racism, because for me, this just feels like the racism wasn't even disguised. In HIV/AIDS, it was initially, whereas in this case, we thought it would be so different. There would be that solidarity, the sharing of knowledge, and that didn't happen. So, the lessons from HIV/AIDS, I think, just became clearer last night when we had a panel discussion with David Kessler, who's in charge of the Biden White House team on the COVID-19 response. And, incredulously, in October 2021, we're having the same discussions we should have had, one imagines a year ago, where a government like the US, which is considered to be so powerful, that has put a lot of funding into particularly Pfizer, Johnson & Johnson, and Moderna's vaccine, is saying to us that they are still negotiating with the CEOs and the boards of these pharmaceutical companies. They are still having a conversation about manufacturing and sharing of knowledge. And so, I don't know if any of you heard the conversation last night, but it was really disheartening, because I think it goes to what Kamran and Peter have talked about, and that is financial greed. There is so much interest in extracting profit and extracting wealth and extracting, there's a number of overnight billionaires, our colleagues in the People's Vaccine Alliance have reported on this, that they, even with 5% or the 2.6% of vaccination in low-income countries, which is really, really, I think, a political embarrassment, an economic embarrassment, social embarrassment, that even with those low figures and COVAX cutting its own forecast and saying we simply don't have supplies, right, that companies are still sitting around the table and having these conversations with elected leaders who are saying to them, share the tech, and they're like, no, not this month. Maybe next week. No, maybe next year. Only with that company, not on these terms and conditions. No, you can't export. Yes, you can export. So the question goes to, can we have so much self-interest in money and extracting profit that you are willing to withhold a life-saving technology to millions and millions of people around the world? And so I think I agree with Peter. What are the boards of these pharmaceutical companies doing? They have a fiduciary duty. How can the chairperson of the board of Moderna refuse to share the technology with the rest of the world, be celebrated and get an award for leadership? How can this be the leadership? The CEO of Pfizer, who said that the reason why Africans are not getting more vaccines is because they're vaccine hesitant, and that it will take some time for people in Africa to be convinced. And he said, countless other things which Tian and I have tried to address. He also said that Africa is not the hardest hit continent, which is not exactly true. So how can you have a situation that CEOs of pharmaceutical companies have more power than the DG of the WHO, than elected leaders? And I think it goes to the fact that these elected leaders, particularly Boris Johnson, formerly Angela Merkel, a lot of these governments have actually propped up these pharmaceutical companies. And we saw that with the HIV/AIDS, is that you cannot exercise so much power and control unless you have the political support of those closest to you. And we've seen that with the TRIPS waiver. The countries that are blocking the TRIPS waiver are countries that are fundamentally led by people who have political parties that are heavily funded by the pharmaceutical lobby. All those companies are headquartered there. The fact that the German government cannot force BioNTech to share its technology with the rest of the world, the fact that the Biden administration is still having nice conversations with, you know, 3 leading companies that could actually take us out of this pandemic much faster, tells you, I think, the levels of greed that we are dealing with, and also the levels of power, which is obviously very reminiscent and similar to the HIV/AIDS crisis. In some respects, these are the same companies, but none of us ever thought last year, when we gave the warning bells around never trust volunteerism, never trust benevolence, never trust donations, because we've learned this from the HIV/AIDS crisis, none of us thought that it would still take so long for world leaders in this pandemic, because we're so interconnected with this pandemic, with variants circulating, with, you know, potential additional waves, and like Peter said, what comes after Delta, I think Cameron said what comes after Delta. None of us thought that political leaders would be so scared. And I mean, you know, let's also just lay a little bit of blame at African leaders, right? So, I mean, you know, the South African government and Indian government have been pushing for the TRIPS waiver, but you knew the kind of blockages and obstacles you would face. I mean, we all hoped we didn't. So have we set up our laws to be ready to issue compulsory licenses? Why are we so scared on taking on pharmaceutical companies? I mean, we know why, we know the trade pressure, but if you're not going to use those powers, I think it's what, you know, the DG of the WHO said last week, why have provisions in the TRIPS agreement on a TRIPS waiver if you're not going to use it? If you're not going to use it in this pandemic, we're never going to use it. So, yeah, you know, unfortunately, a lot of deja vu moments of the HIV/AIDS crisis. But I think Peter is right. What turned the tide on HIV/AIDS was that all of us basically mobilized to force the drug companies to issue multiple licenses, to increase the number of manufacturers. Until then, we didn't have a turning point. And so when people see our response to Moderna, Pfizer, and Johnson & Johnson, it's not because we are anti-private companies or anti the pharmaceutical industry. It's because we know that time is against us. People are getting sick and dying. If we don't force these companies through public pressure and public activism, because governments are not going to get this on their own, we have to increase the public pressure on these pharmaceutical companies and their boards to actually do the right thing. And right now, to scale up manufacturing, participate in the mRNA hubs, and stop diverting supplies to richer countries that already have sufficient supplies. Thanks.